What's the percentage of the brain that's made up of cholesterol?
Well, actually, most of the material in the brain is made up of cholesterol, but that is not the cholesterol that we measure. See, we wouldn't even have a statin drug unless they discovered years ago that you could measure cholesterol in transport, and that means the cholesterol that's in your bloodstream. So that was what they could. I mean, so when they tell you you have a high cholesterol number, that's not the amount of plaque you have in your arteries. That's not the amount of anything accumulating anywhere. That's an amount of cholesterol that's traveling through your bloodstream on its way to do things. So it's almost meaningless.
There's no history of heart disease in my family or in myself. Do I have to lower my cholesterol if my physician says it's too high?
In my opinion, absolutely not. There's no point. Again, if we talk benefits and risks, what are the benefits? There are no benefits. What are the risks? They're huge. It's unfortunate that there's been such a brainwashing of physicians, in particular cardiologists. You know, 80% of cardiologists take statin drugs. They are so convinced that these drugs are the wonder thing of the world. And it's not like the doctors are trying to push drugs on you. They're good physicians, they're good people. They honestly feel that these drugs will help you, and so because they care about you, they tell you, please take the drug, I take it too, and so on and so forth. And this marketing technique works so well that the #1 prescribed classification of drugs on this entire planet are drugs to lower cholesterol. #1. The drug companies pull in $20 to $30 billion a year worldwide on the sale of these drugs.
Over the years, have you found that there are other people like yourself, health professionals, who have the same points of view?
Very, very few. I mean, there's a doctrine out there. You know, take cholesterol. You should take cholesterol. You know, don't take any risks. You might get a heart attack or a stroke. I mean, one of the most common ailments that people get in their 50s and 60s is called atrial fibrillation, where suddenly your heart just starts going really fast. You know, you might get 200 beats a minute, then your blood pressure goes up just out of nowhere. And they usually prescribe blood thinners for this condition so that you won't get a blood clot. But the minute a patient shows up, you know, with this particular condition, right away they put them on cholesterol drugs. Any kind of thing. You got angina, put them on cholesterol drugs. Any heart condition at all, put them on. But the fact of the matter is that most people who suffer heart attacks and strokes have low levels of cholesterol, not high. And that's a fact.
Jeez. And what about people who are taking blood thinners, cholesterol medication, and blood pressure medication all at the same time?
Yeah, well, the thing is that, again, physicians always throw in the cholesterol-lowering drugs into the mix. But what a lot of people don't realize is that nearly all your drugs are detoxified in the liver. So the blood thinner, if you're using the old-fashioned blood thinners like Coumadin or warfarin, they are very slowly detoxified in the liver. And all these drugs, the blood pressure pills, the cholesterol pills, maybe possibly the tablets to treat the glucose problem, the diabetes, everything gets backed up like a toilet. So you wind up with higher doses of these drugs in your blood system because you're taking the blood thinner. And then you'll get, you know, and the doctor will say, to a person who takes all these drugs, well, you know, you really shouldn't take those supplements, you know, they're really dangerous. They could be contraindicated with your drugs. When the truth is, as long as you're taking a blood thinner, every drug is contraindicated with a blood thinner. I'm making this video today that people should really understand that cholesterol is not your enemy. Cholesterol is your friend, and you know, it's a natural substance to have in your body. It heals everything when you go to sleep, and it's not an issue to be concerned about. And if you want to live a long and healthy life, stay away from statin drugs and don't worry about your cholesterol level.